I'm going to try to have people more so do more journaling and different things too in this process to really try to monitor more subjective changes in symptoms over time too. And I think that's incredibly integral in these systems, because there's going to be a lot of waxing and waning of symptoms, and there's going to be kind of an evolutionary process here. And sometimes when you feel ill every day, it's a little more difficult to recognize progress too. So I think that really one can do themselves a favor, and they can also do the practitioner a favor by journaling symptoms and trying to write things down. Because if you also have brain fog and other things, which is quite common in these conditions, it's going to be harder to really know if anything is working. And sometimes things operate at a snail's pace, but we have to remind ourselves that there is progress being made sometimes, because it can feel like a long, arduous, sometimes hopeless journey. And it's not that there's no hope here, it's just that it's long, and it's not like an acute illness like we suspect. We're supposed to get better relatively quickly, even if we have a devastating pneumonia that lands us in the hospital. Even if it's a month recovery, that's long for most people. So years is way too long in our psyche. So we have to sort of reframe that a little bit. And one of the ways that I try to emphasize that is through the journaling of symptoms too. So I try to do my part any way I can with labs, and then I try to encourage the patient to do their part in different ways too. So yeah, that's just another example I wanted to put a little plug in for.
Yeah. Having hope is so important, and as you said, when the symptoms are there every day, and those days have gone into years, it is very difficult. I'm always amazed at the level of resiliency and hope I see in people who have been ill for a long time, because I'm really, it's impressive, because there are times when when I've had acute illnesses and I'm not a good patient, and I am just amazed, because and it's what's needed. It's a difficult journey, but the hope, it has to be there. And the thing is that I can only tell people is that just because you tried something in the past, we keep learning. I mean, I'm amazed when I look back over the last, 20, 30 years, how I started with, I feel like I had Fred Flintstone tools in the beginning. All we had was, we cleaned up people's guts, and we maybe killed the bug, and maybe give them a few hormones, to balance things out. And we have so many more tools now, and we understand so many more stumbling blocks. And as you laid out so beautifully, I mean, like all these systems, each one of them can malfunction and can stay malfunctioning, because once the body forms a habit, it likes to keep it there, even if it's no longer serving you. So it's just so important to keep the hope, because we will come up with something eventually.
Yeah, it's a process for sure. I mean, yeah, don't lose hope. It's just it takes time, and every year we're learning something new, and there are emerging therapies, of course, too, for some of these things that are coming out. And I think those of us that try our best to kind of keep up with new knowledge and sort of cutting edge, there's a whole group of us out there, so you can find people. You may not find them the first time you look, but you can find people, so they are out there.
Yeah, and more, and I always put in a plug in for patients, because patients are amazing researchers. Those even people with brain fog, I'm amazed what they bring to me. How many, because the new, there are, in the last, it really is, I guess it is the internet. I mean, like, because it used to be ideas would just like sit out there, and now they're exposed to so many, on so many different platforms, that and again, not everything works, and some ideas are, but I think the ones that are safe are worth trying. I mean, the ones that have that are dangerous, I think we have to agree with the general medical community. We should move slowly on if there's significant downsides too. But there are so many things that we use that the downsides are minimal to non-existent.